Ekiti State Community and Social Development Agency, EKCSDA, is an organization designed to foster community-driven development initiatives in the state. The agency is currently executing Delivery Link Indicator DL 1.4 of the Ekiti COVID-19 Action Recovery and Economic Stimulus tagged EKCS, which is a critical component of the state's response to the pandemic associated with COVID-19 and other socioeconomic problems. The mandate and objectives of the agency are tailored towards empowering local communities in Ekiti State to take charge of their development processes. This enables communities to identify, plan, implement, and monitor development projects that are crucial to addressing their immediate and long-term needs. EKCSDA, established and funded by the Ekiti State Government, operates within the framework of the community-driven program and supported by the World Bank. The general manager of the agency is Mr. Yemi Alatishe.
EKCS is a domesticated name from Nigeria Cares, which is a project designed in tripartite with the World Bank and federal government and the state government to provide a little bit of succor for the people after the outbreak of COVID-19. The two tiers of government, in conjunction with the World Bank, discovered or realized that as at that time, a lot of people were thrown into abject poverty as a result of the outbreak of COVID-19. Their livelihoods were badly affected. Basic infrastructure were totally not functioning anymore because people could not have resources to sustain the existing ones. And even those that were in existence were inadequate to cater for the aftermath effect of the outbreak of COVID-19. And so the governments, both at the state and the federal, had to put us together as to see how they can really assist the badly affected citizens of the nation on how to come out of the shock that resulted from the outbreak of COVID-19.
A key aspect of the EKCSDA strategy is the participatory approach to socio-infrastructural development in the state. The methodology ensures that communities are deeply involved in all stages of project development, such as initial project selection and subsequent management. The agency is currently intervening in 4 key areas as approved by the state government. They are education, earth, water, and sanitation, as well as flood and erosion control. Mr. Femi Ujuawu is the Director of Finance and Administration. He speaks on the selection process of benefiting communities.
EKCSDA is into community infrastructural provisions, like water, like educational facilities, like water and sanitation, environmental issues, erosion control, health facilities. So if what you're requesting in your community falls under this, is disaggregated, and those lists are sent to us from Mr. Governor's office. We also pick you after looking at the poverty map and other indicators that other indices we are supposed to use. So in essence, I want to sincerely, on behalf of the agency, appreciate Mr. Governor, because I can say very clearly, unlike what happens in some places where they bring politics into all this job, Mr. Governor has given this agency a free hand to use the normal procedures of identifying communities that should benefit. So it's the poorest of the communities, whether you are a community supporting the opposition party, a community supporting the ruling party, whether you are a Muslim community, a Christian community, or you belong to other religions, all those ones don't play here. Poverty does not know color, does not know religion, does not know even ethnicity.
Mr. Folarin Oshatuyi is in charge of monitoring and evaluation. He explains how the agency ensures that the CPMC sticks to the guidelines of the project implementation.
Collect data across sectors of implementation as to know how far they are going in order to correct any noticeable misapplication of rules and guidelines, so that we can quickly do a data run and see how far they are going. We do a lot of research on community growth, community scoping. We do a lot of things on how the project can be well implemented based on existing guidelines, so that they will not move outside the guidelines. The guidelines are very strict. So that is why we have a very, very low rate of misapplication of funds in the communities. And you know, communities do these things themselves. So we don't award contract. Community will implement the part finance through their contribution, counterpart contribution, and they implement on projects that they decided on their own. So without any intervention from the agency. So
Currently, the number of benefiting communities stands at 238, and the breakdown of completed and functional micro-projects across the communities and their sectoral classification are education 116, earth 142, water and sanitation 191, flood and erosion control 43, totaling 492. EKCSDA has trained 1,980 CPMC members for capacity building on projects implementation, participatory governance, and project sustainability.
I'm highly respected chairman of CPMC and members that are here this morning. You are all welcome to this program.
Àwọn náà lè borí ṣùgbọ́n gbogbo nígbà borí papọ̀. That is community tí tó jẹ́ bí a láti mọ̀ nìyẹn. So gbogbo àwọn fẹ́ ṣe lórí orí wọn ló wà. Ẹ̀yin náà tẹ́ náà lọ́wọ́ ní orúkọ Jésù. Mo gbàdúrà àwọn ọlọ́pàá wà pẹ̀lú yẹn.
It's just not for cover the necessity for us to have understanding of the process. But in adherence to the guideline, then we can move further. Ọ̀nà àmà gbòòrò tí a bá ṣe dáadáa, wọ́n sọ pé ó pè àwọn state tí wọ́n ṣe tí wọ́n dáadáa yẹn, owó tó yẹ kó fún wọn, wọ́n lè jàgbà, wọ́n kó fún wọn. Then wọ́n á tún ṣe mọ́ project, basic project in the state.
The agency was also able to resolve 4 project implementation-related crises across the state. The projects of the agency are spread across the 3 senatorial districts of the state, namely South, North, and Central. Each of the projects has a Community Project Monitoring Committee which ensures its implementation from the scratch to completion and sustainability. The CPMC members, the traditional rulers of benefiting communities, as well as other stakeholders, gathered at the Government House ground in Ekiti, where the governor, Mr. Biodun Oyebanje, presented checks of the project's values to them.
I'm proud of the successes that EKCCSDA has achieved in the past 1 year, especially in getting the deliverables ready for the implementation of basic services infrastructure. I therefore urge our revered royal fathers, chiefs, elder statesmen, and the Community Project Management Committee members to see this as a collective responsibility and take ownership. We must ensure qualitative and timely delivery of this project for the good of our people.
The Honorable Commissioner for Budget, Economic Planning and Performance Management, Mr. Niyi Adebayo, whose ministry is supervising the agency, says that EKCCSDA, with the support of the Oyebanje administration, has performed creditably in community development through the various micro-projects spread across the nooks and crannies of the state.
EKCCSDA's role is to upgrade the infrastructure in all of our communities and our rural areas, covering different sectors from education to health, like renovation of primary health care units, what we call maternities, or consulting clinics that are in our rural areas, creation of borehole infrastructure where potable water is a problem or a challenge in some of those communities, and also, trying to fix some of the roads that may have been adversely affected by, maybe erosion and those kind of things, because being able to move around is also an economic matter. So if people cannot move because the roads are impassable, then it also affects their ability to go about their daily lives the way they ordinarily will. Those who want to go to farm may not be able to go. The women who are going to the market and men who are selling may not be able to access the market. It also may mean that those who need to buy from these markets will be challenged as to be able to even go to the markets and come. So that's where EKCSDA comes in, to help to build the infrastructure that keep life going in these communities. And I feel very proud of the EKCSDA, of the agency, in how they have executed all of the projects that they've done. They pay close attention to what they are doing, and they work with different communities. These communities are usually put in charge, but I must say that EKCSDA takes pains to ensure that they supervise each of the committees that the communities set up for each of these projects, and they ensure that they adhere to the terms of engagement, and that all of the projects are executed in accordance with the guidelines of the NG Cares project.
Also, the Permanent Secretary of the Ministry, Barrister Olushola Akinloye, speaks on the transparency in the operations of EKCSDA.
The agency has been effective in delivery on the mandate given to the agency. Activity of agency basically is community driven, such that the communities, they bring up programs and projects to be executed within the community. And in most cases, it has to do with water, erosion control, flooding, and the likes. And on this mandate, the agency has been very, very effective. The feedback from the community shows that the agency is delivering on the mandate. Not only that, we have the monitoring unit in our ministry whereby we go about monitoring activities of the agency. And I can confirm that what we meet on ground conforms to standard, and is up to standard as required by federal government and World Bank in respect of EKCS program.
Mr. Festus Ogunride, who is the state coordinator of EKCS, affirmed the efficiency of EKCSDA in the delivery of micro projects in the state.
EKCSDA being a veteran in this area of community infrastructural development, and we not have much problem working with them because the experience over the years has really helped, in delivering the results of this program. Then I want us to also understand that the EKK, the NG Care came up as a result of the effect of COVID-19 on the socio-economic cycle of all Nigerians, and the emphasis now that the need for the poor and vulnerables who are much more affected, particularly the communities, even to be supported, even for the loss of opportunities, loss of income, and social amenities that arose as a result of the lockdown occasioned by the pandemic. And EKCSDA has not done bad. They have been giving us good results. All their works are dotted across all the community in the 16 local governments of the states. And it's obvious, visible for all to see. It cannot be contested. And when you look at the area of erosion control, on the environmental sector, you see the construct drainages, culverts, then the area of water supply, the construct of the installation of these solar power boreholes. And when you look at the area of earth, they have also done well, because some of the structure we had before now in all these facilities that have even been put in place for maybe over 30 years have become dilapidated. So with this program, the intervention are really supported in making sure that some of these lapses, gaps are being filled. So some of them are pulled down, even some newly are constructed apart from the renovated ones. And by the time the community see the good what they are doing, they'll be coming up with a request And every other community where this intervention are taking place, you know, they are placing the state government in collaboration with the federal government that made this project, you know, possible.
The agency has recorded tremendous success in all the projects executed across the length and breadth of the state, as attested to by the committee members and beneficiaries. The General Manager of EKCSDA, Mr. Yemi Alatishe, speaks on the funding envelope for EKCS projects.
Due to increased economic hardship, the present governor unanimously approved the increment of the funding envelope of the project for minimum 2 CDPs from 15 million naira to 21 million naira. And considering the fact that people are becoming poorer and poorer, he also further gave approval that from 2.5, which used to be the contribution from the communities, that it further be reduced to 1.5. So it has made the project so easy. The governor has so made it easy for communities to participate, to benefit from. And for people with disability, they just have to pay 0.5%. So that is how communities participate and get involved in the project.
Randomly, the projects selected for this publication are of high quality. At Ise Comprehensive High School, Ekiti, the projects executed were the renovation of the examination hall, procurement of home economics tools like sewing machines, gas cooker, pots, stoves, cutlery, and science equipment. The school principal, Mr. Folaromi Jacob, and the school head boy, Fashui Oluwafemi, commend EKCSDA for coming to their aid.
The hall was so bad, so dilapidated. So there was no way for this one. We were finding it difficult where to sit for the exam. But by the grace of God, we moved around and we came in contact with EKCSDA. So when we came in contact with them, we tailored our needs, and by the grace of God, we succeeded.
The opportunity given to us was a huge opportunity from the EKCSDA, as we now write exam comfortably. It's now a conducive place for us to write our exams.
God will continue to be with the governor and those that are working together with him.
At Ise General Hospital, Ekiti, EKCSDA's intervention included drilling of a solar-powered motorized borehole, provision of solar lights and medical equipment. Dr. Aziz Atonda is the Chief Medical Director.
At first, it was like a film when the youth of the town approached the facility and asked us for the things that we think may boost our performance in the hospital. We thought it was quite a joke when we made a comprehensive list of the things that will actually improve our functionality in the hospital. And that should be around April. To my surprise, within the space of 2 months, it came as a shock when I saw a 5 kVA complete solar inverter set and some very expensive laboratory equipment, and also some 5 3-crank beds, very beautiful ones, and watch screen and many other things like that. It's been beautiful.
At the United Comprehensive High School, also at Ekiti, the projects executed include the purchase of 120 chairs and lockers for the examination hall, which has already been put to use.
The school authority approached them and they laid their shortcomings and problems. And we thank God that the agency quickly intervened and solved this problem. In fact, it is a very good gesture. We've been trying, we've heard about them in very other schools. So we also appreciate our governor, at least for financing this body.
With the support of the EKCSDA and the Ekiti state government, led by our governor, Mr. Bao. So we were really appreciated them for giving us the honor and to support us.
At Ekiti, the government special school for the blind was not left out of the Exeter's intervention. The agency assisted in the construction of an examination hall and equipped it with 60 chairs and lockers, provision of solar lights and medical equipment for the health center in the school. The stakeholders bear their minds on the success story.
Because when we're talking about school setting, there is a need for a conducive environment, and that is what Mr. Governor is after for this school, especially persons with disabilities. So it's very interesting in our comfortability and a conducive environment for our students, and that is why this was given an approval, even a quick and fast approval, and provision were made. So for now, it makes it easy for our students to, write their exam in a conducive and comfortable environment. So we thank God for His Excellency and the agency.
This project is going to help our students a lot because they have access to the hall, as in by using it for their examinations. There's no need of going to the secondary school again to do exam, because at times when they go to secondary school to write exam, we make use of typewriters. So at times the teachers there, they do tell us that we are disturbing their students with that sound of the typewriter. But by the provision of this building now, no need of writing exams with the other students again. At least they are now free to write theirs in this hall.
At the Corpus Christi College, Ekiti, the Exeter projects executed were the renovation of the examination hall, supply of chairs, and renovation of the administrative block. The representative of the school principal, Dr. Dari Akidele, applauded Exeter for the execution of the projects.
In the past, this hall, it wasn't like this, it was reshaped. This is our school multipurpose hall for examination, different external examinations. Like this rainy season now, students will be moving their lockers and chairs from the hall because of the drop of the rain. But as soon as this hall have been renovated, we have been enjoying every bit of examination from here. Even the placement of other schools, the children love to be here. So we have been using it for external examination, for internal examination, as you can see today.
Also, the chairman of Abekpe community, Chief John Chegede, commended the agency and the Ekiti State government for the projects, which he said had impacted the students and the community positively.
Exeter used to come here to assess the viability of those needs, and the meeting was arranged between the committee, which was set up at the instance of Exeter, of which I happened to be the chairman. We were able to agree on the two projects after considering others.
Also, a solar-powered motorized borehole was provided for Olorunshogo community in Ekiti. Mrs. Amujo Taiwo says that the intervention has brought to an end the stress of getting water from far places.
Àtọ́jọ́ ti ṣe náà láti pọ́n táwọn èèyàn bá ti wá bí wọ́n máa ń ṣàdúrà fáwọn tó ṣe náà ní ọ̀tẹ̀ ọ̀jọba a máa rí kan lóòrèkóòrè tó ọ̀pọ̀lọpọ̀ omi ládùúgbò because kò sómi ládùúgbò yìí àwọn èèyàn tó bá dẹ̀ tí wá pọ́n wọ́n máa ń ṣàdúrà fáwọn tó ṣe omi yẹn.
At Ikole local government area in Ekiti North Central District, Exeter intervened by providing a solar-powered borehole at Ansaruddin Central Mosque and renovation of a basic health center in the community. The community people appreciate the agency for the intervention.
The Exeter has really done well for this health facility and the Oro community. After the renovation, we are very happy because the building itself, me looking at it on your way coming in, you will know that something good has been done in the health facility. The renovation has been so fantastic, and it has been enable us to see a patient that was rain is not disturbing us again. Even our deliveries, we have been able to deliver more services to our people. The care is more accessible to our people now, more than ever before.
At Oduayedun, the intervention of the agency included construction, procurement of medical equipment, and drilling of a solar-powered borehole at the Community Health Center at Imila. A health official, Mrs. Oluwole Caroline, says the intervention has brought relief to the people of the area.
We really appreciate them now. We appreciate them for good work that they have been doing, and we are very impressed.
At the Oduayedun Primary School, also at Imila, a block of classrooms was renovated. The headmistress, Mrs. Aribisala Olajumoke, says that the pupils now enjoy a conducive learning environment.
We appreciate the efforts of EKCSDA for the work done, a job well done, for giving this place a facelift. And this will enable the pupils to assimilate what they are being taught in the class.
At Ekiti, the Exeter projects there included construction of a science laboratory building at Itakpaose Comprehensive High School. The vice principal, Mrs. Olatimei Funke, says that the building would enhance the study of science subjects.
Having this project on the compound at least improves the capability of the students. Physics, chemistry, biology, and even with the structure, the students are even willing from other subjects to student science subjects classes.
A solar-powered motorized borehole was equally provided for the residents of Oroke Street in Ekiti, where Mama Deborah Ajiboye thanked the agency for the life-saving intervention.
Lẹ́ẹ̀dọ́pẹ́ láìjọba kan bá ṣe omi torí àgbádùn omi ògbà gbogbo ẹ̀sùn gbà kà fẹ́ pọn mi pọ́ṣọ̀ ọ̀rọ̀ láàgì kà fẹ́ pọ́n omi à pọ́ṣọ̀ sín omi à ọlọ́run àtẹ̀bọ̀ gbòṣẹ́rin aga o ìjọba àpá bá.
At Oloje Ekiti, Exeter supported the community in the drilling of a motorized solar-powered borehole which has been serving the people of the area, as attested to by Mama Florence Fabiyi.
Wọ́n ṣe ọ̀túnra ẹ̀ ọpẹ́ lálẹ́ ìdá lọ́wọ́ wọn torí wọ́n ṣe dáadáa òye omi gíá gbogbo ọgbẹ́lẹ̀ ní pátápátá lọ á ní fílì omi mọ́.
Isaoye Ekiti in Moba local government area enjoyed the renovation of a F facility, a solar-powered borehole, and security lights in the community. Oba Olajide Gabriel thanked Exeter and the state government for the projects, which he said have been having great impact on the people.
The project is so much awesome. We thank God for the intervention of Mr. Governor and the EKCSDA for coming to our aid in the community, because we are so happy to have them and see.
Inú wa dùn lọ́pọ̀lọpọ̀ fún iṣẹ́ yìí torí báwo wọ́n gbìyànjú fún wa gidi gan pàápàá jùlọ nínú ìlú Ìsáòyè pẹ̀lú renovation of health center yìí àdúpẹ́ lọ́wọ́ wọn torí àwọn èèyàn wa ń jàǹfààní lẹ́rùngbà tí akátá parí gan àti rí àwọn bíi méjì tán ti bímọ síbi tí inú wọn dùn tó rẹ̀ jẹ́ pé àwa gan ayọ̀ wá fún.
Also, a health worker, Mrs. Adebayo Adefunke, said that the facility had improved health care delivery in the area.
Inú wa dùn sí torí àwa náà ti dẹ́gbẹ́jọ sẹ́ńtà wa ti dàbí ti ìgbàlódé, ó ti yàtọ̀ sí ti tẹ́lẹ̀. Sólà ni wọ́n ti fún wa níná 24/7 nísìn àti níná kò sí pé à ń wá ná káàkiri, wọ́n dẹ̀ tún bá wa péǹtì ẹ̀, wọ́n tún bá wa innovate àwọn páànù iron sheet, so inú wa dùn sí gidi.
At the Otun General Hospital, The agency supported them in the procurement of shelves and medical equipment, as appreciated by health personnel, Mrs. Bello Catherine, emphasizing that the equipment have been of great use to the people.
We are happy to be part of the people that benefited from the gesture, because with all these things in place, like Sonicate is a new instrument that you use to measure the heartbeat of the inborn fetus, unlike in the olden days that you have to, press the tummy of the pregnant women that they will begin to feel pains and feel uncomfortable. But with this, we are happy to be part of the gesture. Our appreciation to the EKCSDA, the state government, we pray the Almighty God will continue to shower His mercy upon them.
EKCSDA, under the EKCS, also supported in the construction of e-library and the provision of library equipment at Adeoti Secondary School, Osun Road, in Otun, Ekiti. The principal of the school, Mrs. Oyemide Cecilia, says that the computer sets and the solar-powered Wi-Fi have been useful for both the students and the teachers in research and e-learning.
They've done well, and we pray that they will continue to do good things for us. We are happy with the project because we don't even think of it at this time around. But when they came and told us they are going to give us this e-library, in fact, we are very happy. We are very happy. The staff and students are very happy with the project.
At Ekiti, the agency supported the community in the drilling of a solar-powered motorized borehole at Onala Street. Residents of the area expressed appreciation to EKCSDA and the state government for making their dream come to a reality.
Èyí náà rí báyìí pé iṣẹ́ lẹ ṣe, iṣẹ́ níjọba ṣe lórí project náà. A sì dúpẹ́ lọ́wọ́ àwọn ìjọba wa tó bá wa gbé síbí yìí. Ayébo tòrú làwọn èèyàn wa máa ń pọnmi òun níbí yìí.
The renovation of the VIP toilet at St. Michael's United Cherubim and Seraphim Nursery and Primary School, Ekiti, is also worthy of mention. The Secretary of the Community Project Management Committee, Mr. Gbenga Olubopade, applauds the agency and government for ensuring the actualization of the project.
We have to acknowledge the support of the Mr. Governor, Mr. Oyebanje Abayomi Abiodun, and the EKCSDA agency for sponsoring and initiating this laudable project. And we are very happy that our community, we are beneficiary of the project. Here in Ekiti, we are having 3 different projects in different locations. At Ido Ward 1, we do have a solar-powered borehole, which is situated at Odoyedi, at the frontage of the Aladeshose house, while the second one in Ido Ekiti Ward 2 is also located at the frontage of Faku Ade's house at Onola Street, Ido Ekiti. This is a VIP renovated project, VIP toilet here at St. Michael, Ido Ekiti. Is financed and sponsored by EKCSDA under the leadership of our able governor, Bao.
Also, in Ado Ekiti, under the EKCS, the agency supported in the drilling of a solar-powered motorized borehole at Awedele Market. Overwhelmed by the intervention, the marketers invited the management of the agency to the site to show how happy they were with the support. Speaking on behalf of the others, the Yaloja Chief Oluwafunke Ogunride said that the facility had brought relief to the marketers.
Ọjọ́ kan ṣekú àádùn alójú lọ́jà wẹ̀dẹ́lẹ́. Ọjọ́ kan àti irúṣẹ́ ni mo ti ń tẹ bọ́tì kí mo ṣe àmìrà kò ṣe. Kákọ̀yọ̀ dúpẹ́ káyọ̀ mọ̀ wí àná mọ́ọ́rẹ́. Fọ́nìyàn nẹ́ẹ̀tì kan mú yí ká kọ́lọ́ ní bá a ṣe lúlẹ̀ rẹ̀ àmọ́ bí kò á sákàdé kéésì jẹ́jẹ́. Ẹ̀sọ́ ni kéèméje kẹ́ẹ́tà pé sìmẹ́ǹtì. Ń yan bá ní bá ara méje kẹ́ẹ́ra ọjọ́ àwẹ̀dẹ́lẹ́ lójú. Àti ẹ̀dúpẹ́ pé àsìkò tí bá òpin ọjà ń tẹ̀síwájú. Àdúpẹ́ pé
báwo ọlọ́run di báwo mú ọlọ́run kọ́ lọ́gbọ́n ọlọ́run fún lóye ọlọ́run gbà fún láti pé kí gbogbo nǹkan tó ń dánwọ́ lé kó ṣeé ṣe a gbé ọlọ́run ga lórí bàbá wa báwo àwa fi àsìkò yìí dúpẹ́ lọ́wọ́ báwo pé wọn ò ní jábọ́ ìjọba wọn ò ní dàrú.
Humbled by the acceptance of the project, the general manager of EKCSDA, Dr. Yemi Alatishe, urged them to own the facility and ensure its maintenance.
Well, my major message to them is that they should sustain the project, they should maintain it, they should look after it, they should guide those projects very jealously. Let those projects be dear to their very hearts, so that the essence of government spending huge sums of money on those projects will be justified.
So ẹ̀dẹ̀ ti sọ wípé nǹkan tó wù yín lélẹ̀ mo dẹ̀ mọ̀ wípé inú yín dùn sí ìjọba yìí torí pé wọ́n ṣe nǹkan tó wù yín ẹ̀ẹ́dì nǹkan tẹ́yìn sọ wípé ó wù yín gangan lélẹ̀ Ọlọ́run á sì jẹ́ kí ó ṣe yín láǹfààní.
Also, the Bashiri Health Center in Ekiti was supported with a solar-powered motorized borehole, and the community people could not thank the agency enough for the intervention.
Fún ohun rere yìí tó pẹ́ tá a ti ń retí tá a rí a dúpẹ́ lọ́wọ́ yín ẹ ṣé gan-an ni mo dẹ̀ dúpẹ́ lọ́wọ́ gómìnà wa gómìnà Bao ọwọ́ wọn á máa lọ síwájú wọn á ṣàṣeyọrí. Bẹ́ẹ̀rẹ̀ máa tẹ́ wà lọ́rùn Bao máa báṣẹ́ rẹ̀ lọ.
At Iloro Ekiti, the agency intervened in the renovation of the community health center and the staff quarters, drilling of solar-powered motorized borehole, provision of solar electricity, and procurement of medical equipment for the facility at Okeodi Street. This did not go unnoticed, as the stakeholders thanked the state government and the agency for the lifeline.
This quarter is a dilapidated building, but being innovated and funded by EKCSDA, the already existing local governments. These are the medical equipments funded by EKCSDA.
Gbogbo bí pátá tí wọ́n ṣe àtúnṣe ẹ̀ báyìí gbogbo èèyàn ló sì rí pé bó ṣe ń dán mọ́rán tó dẹ̀ dúnyàn gbà fún gbogbo Ìlọ́rọ̀ community. A sì ìlú sì dúpẹ́ lórúkọ kábíyèsí James Olúgbésóyè the Olóró of Ìlọ́rọ̀ Ekiti lọ́wọ́ EKCSDA àwọn tún dúpẹ́ lọ́wọ́ ìjọba Ekiti State.
Àwọn ọ̀nà tí iṣẹ́ yìí gbà dúró dáa nílùú Ìlọ́rọ̀ Ekiti ó pọ̀ rẹpẹtẹ. Ṣé tómi ni ká sọ ni tí àwọn èèyàn benefit tí gbogbo àdúgbò yìí pátápátá tán kan tínú wọn dùn lójoojúmọ́? Ṣé òun ni ká sọ ni àbí ilé tó ń dán mèremère tí àjọ EKCSDA ṣe fún ìlú Ìlọ́rọ̀ Ekiti tó ṣe wípé àpèwá wò ni kò sẹ́ni tó máa kọjá líbítàn ní máa ṣàdúrà fún àwọn àjọ EKCSDA pé wọ́n ṣe é gan ni wọ́n kú iṣẹ́ takuntakun ó gbé Ìlọ́rọ̀ lárugẹ.
In Ekiti, EKCSDA assisted in the provision of a solar-powered motorized borehole and renovation of the health center.
This place is not that okay before, but now after the EKCSDA project, after the project has been completed, we can see the place is lively, is in a good limelight, and we are very, very happy having this kind of project renovation here, because also to improve our health services, community continue access to good health services and the good infrastructure.
And back in Ekiti, the Onola Moses Falayi Bridge that links Afa Road from Adeun Car Wash was constructed through the support of the agency. The people of the area applaud the government and the agency for ensuring the actualization of the long-term dream.
As you can see, it controls the frequency and waves of this water from damaging other people's farms and other things. And before, we used to have slow movement of cars in this place. Like, it used to be more muddy and very I can't say it was managed well, but now, as you can see, there's a lot of improvements and everything is going fine.
The road is very bad before, because we are doing it before, but it's not, we can't capable to finish the bridge. So we now went to the government to help us. So we thank God for Mr. Bao, our excellency, that he helped us to finish our bridge because before the bridge is not well okay. We can't even pass there. But now we are so happy that we can be able to pass there now. So we are thanking Mr. Governor, our excellency, Bao.
At Owode community, 400 meters drainage system with a culvert were constructed, while solar-powered motorized bore was also sunk. Prince Ojo Adeniyi Olugbenga is a resident.
Before the intervention of EKCSDA, we don't have water here. We have water problem. People used to go to other communities to go and fetch water, which is not palatable. Then when I talk in time of drainage too, we don't have.
The general manager of the agency gave assurances that many communities will still benefit from the community development drive of EKCSDA.
Those that are eager to come to benefit or participate in the project, we can only advise them that people should not see the project as one of those means of sharing national cake. Because money that is going to be given to your community is meant to be spent on the project.